In a patient-centered environment, how we communicate with others has an immense impact on our effectiveness at work. Communicating effectively can be challenging. We have to build an awareness of how we communicate both verbally and nonverbally, and also how we communicate through social media. We will review how to communicate positively in this unit and also how we should handle social media in a healthcare environment. Let's look at the four foundations of positive communication, or HAIL. The first is honesty. Be clear and straight in your communication. Authenticity. Be yourself and stand in your own truth. Integrity. Be your word. And loving compassion. Wish them well. Let's take a look at an example. Peter has dementia and is feeling very agitated. He doesn't know who you are or where he is. He is refusing to head back to his room at the end of the evening. It would be easy for you to take on his frustration or be short with Peter. After all, he is being quite mean to you. But we have to step back and take a deep breath. Think about HAIL: honesty, authenticity, integrity, and loving compassion. All of these apply to this moment of struggle, but in the end, all we can do is respond to Peter with loving compassion. We have to remember that his behavior is beyond his control, but the way that we respond is within our control. You decide to respond with loving compassion. You will have to make decisions like this one throughout your career as a CNA. Let's take a close look at HIPAA, the Health Insurance Portability and Accountability Act of 1996. HIPAA protects individual health information that could identify a patient. As a CNA, your patients are entrusting you with their most private information. You have a legal obligation to protect this information. Patient health information is protected by HIPAA, which means you can only share patient information with authorized personnel and the patient. You are restricted from reading the chart of a patient you are not assigned to. When it comes to HIPAA, the world of social media is a huge factor. People in the healthcare industry have lost their licenses after violating HIPAA through social media. We need to consider how HAIL applies here: honesty, authenticity, integrity, and loving compassion. Let's take a look at an example and see how it applies. A resident is wheeled past you on the way to the ER. The resident had a terrible fall and has broken a hip and bruised her face. You whip out your phone and take a picture. You just can't believe what you are seeing. She's in terrible pain. You want your other CNA friends to see this. So you go to post the photo to a social media site with a few hashtags, including hashtag glad it wasn't me and hashtag CNA problems. But you have to stop and take a breath and consider a few things. Think through HAIL: honesty, authenticity, integrity, loving compassion. You decide not to post the photo. You do this not only because it is an issue of integrity, but because it also is a violation of HIPAA. Let's take some time to review. Remember the four foundations of positive communication. HAIL: honesty, authenticity, integrity, and loving compassion. Remember your obligations through HIPAA. Always respect patient privacy.